Boleh nampak kan? Alright. So basically So for the airway management, this is first part of airway management lah. Basically after Dr. Nazrul punya kelas, we have the so-called hybrid punya ni lah. Hybrid punya practical session, tapi through online. Alright. So for the lecture on airway management, you need to manage the airway. Is basically there's a fundamental airway management. When you manage the airway, basically you manage the breathing. You manage the airway and then simultaneously you manage the breathing. So the fundamental punya airway, basically you need to first, what you need to achieve is the airway patency. You need to make sure that the airway is patent. Even though you open up the airway, you try to not open up the airway, but it doesn't ensure that the airway is patent. You need to make sure the airway, you need to open up the airway and then make sure the airway is patent. There's a first target. And then the second target is once you open up the airway and then the airway patency is okay, you can give the oxygen to this patient. And then of course, lastly is you need to excrete the CO2 ataupun carbon monoxide gas. Alright. So the technique of airway management, we have non-invasive and also invasive. For the technique for non-invasive, we have a passive oxygen supplement such as Nesaprom, face mask, Venturi mask, high flow mask. That one is non-invasive. We can get the oxygen through non-invasive. Guna itu, we can use a bed mask ventilation ataupun embu bagging lah. We can use this one. And then sometimes you can give the oxygen through NIV, non-invasive ventilation. Basically, dia punya bed mask ventilation and also NIV, you give the positive pressure oxygen. However, for this one, you just give the oxygen supplemental, oxygen sahaja for the passive oxygen. And then for the technique, for the invasive technique, we have the endotracheal intubation and also cricothyroidotomy. We have a surgical airway. We can use a surgical airway in order to give the oxygen. Alright. Okay. So the airway management. Airway management depends on first patient factors. So patient factors, we have a patient possible obese patient. Patient is thin, adult and peds. So how you approach this patient is different. And then number two, the skill of rescuer ataupun the familiarity to the gadget. So sometimes in other center we don't have a video laryngoscope. So the rescuer at that center possible is not familiar with video laryngoscope. So we need to use the equipment, airway equipment, which is more familiar with what in our practice lah, more familiar during our practice. Okay, then the third factors is the phase of resuscitation. Sometime during CPR, sometime during post ROIC, we intubate this patient. During CPR, we need to intubate in less than 10 seconds. because of when you intubate this patient more than 10 seconds, you already doesn't give the high quality CPR. When patient got ROS, patient during ROS, possible you have a plenty time to intubate this patient. You need to prepare patient first, and then prepare the position, prepare the airway, and then you can intubate this patient. However, during CPR, you need to intubate very fast, which is less than 10 seconds. So the airway management, when we talk about patient factors, we have when we talk about patient factors, we have a type of respiratory failure, which is we have a type 1 and also type 2. So when patient having oxygenation problem only, so we need to give the supplemental oxygen to this patient. And then possible patient can have ventilatory punya problem. So this patient kalau perlukan ada ventilation problem, we need to assist the work of breathing. So assist, so we have a SpO2 to detect that patient having oxygenation problem, and then you need to assess the work of breathing. Sometimes patient in respiratory distress, so that's why this patient possible have ventilation issue. So based on that, these two factors, you can easily manage this patient. Kalau just ventilation is okay, but the oxygen is not okay, so you just give the supplemental oxygen sahaja. If patient having both oxygenation problem and also ventilation problem, possible you need to give sometime positive ventilation. Contoh dalam NIV, non-invasive ventilation. You can intubate this patient, and then you need to ventilate the patient through machine ventilators. Okay. Alright. So how to predict the difficult airway and also prepare of airway management. So how to predict? There is a step. First, you need to predict first what is the difficult airway. Is it this patient is difficult airway or is not difficult airway? So how to predict the difficult airway? Ada mnemonic dia. Apa? Tak ingat? Nanti you google lah lemon. You ingat lemon. Tu difficult airway lah. Ada mnemonic untuk difficult airway. You kena ingat lemon. Alright. Okay, first you need to prepare when patient having difficult airway intubation. You need to predict this patient is difficult airway. Of course, for all patient lah. Even though this patient is not difficult airway, you need to prepare step by step. First, you need to position and also prepare for airway. You need to position patient, and then you need to use the certain maneuver for the airway. So sometimes you need give the jaw thrust. You need to give head tilt chin lift. And then there's a position and also airway maneuver. And then second step, you need to prepare for airway equipment. Airway equipment you need to prepare. And then third step is you need to prepare oxygenation. Either you need to give the through high flow mask, you can give through vac mask punya ventilation, ataupun you can give through an IV, non-invasive ventilation. And then next, This one is one of the ni juga. Step adalah you need to prepare back valve mask. Basically, kalau patient still have a spontaneous breathing, you can give you can give the oxygen sahaja. You can give oxygen only. If patient having ventilation problem, you need to give positive ventilation through back valve mask. Of course, if you cannot intubate, you need to prepare for supraglottic device. Contoh LMA. LMA. Alright. And then of course lastly, you need to intubate lah. If patient need for intubation, endotracheal intubation. Alright. How to predict How to predict difficult airway? Basically, we have a mnemonics lah. We have mnemonics for back valve mask ventilation. We have moans, and then also supraglottic punya airway. Supraglottic airway, contoh LMA, we need to insert LMA, we need to prepare ataupun predict whether this patient having difficult to insert LMA. Alright. So to predict, and then how you position this patient yang perlu intubate. Patient need for preparation for intubation, and then you need to position this patient. Alright. So how to position this patient? Satu adalah we need to know the axis. We have a 3 axis, which is a oral axis, which is the cross section ni, dia punya tongue kat sini. Then we have the pharyngeal axis and also laryngeal axis. And then of course we have the 2 curve. We have the primary curve and also secondary curve. We have a 3 axis and also 2 curve, primary and secondary. What you need to do adalah you need to try to straighten this primary curve and also secondary curve. So daripada sini adalah this a primary curve, you need to straighten up, and then secondary curve, you need to straighten dia punya primary secondary curve in order to facilitate intubation. Okay, how? Satu adalah you need to flex the neck. Flex the neck, extend the head, ataupun sniffing position. Flex the neck, extend the head. That's a sniffing position. Why you do sniffing position adalah you need to satu, straighten the curve, primary and secondary curve, in order to facilitate dia punya intubation. How you do adalah flex the neck, extend the head. Okay, boleh faham kat sini? Sniffing position. Okay, what happen if you over punya ni? Bukan over, maksudnya you terlampau hyper extend the head. Instead of you try to straighten up dia punya secondary curve, basically you try to, kalau you hyper extend, you akan cover your laryngoscope, larynx punya ni, vocal cord. So basically dia akan cover dia punya vocal cord kat sini. So basically you need to flex the neck and also extend the head sahaja. Kalau you hyper extend, you akan obscure you akan cover dia punya, dia akan tak nampak dia punya laryngeal punya view. Alright. So when you position, you can have a maneuver. Satu adalah you position, flex the head, flex the knee, flex the neck and extend the head. And then what maneuver to improve visualization of vocal cord adalah you can do BURP maneuver, which is backward, upward, rightward and pressure, backward, upward and rightward pressure maneuver. So kalau you nampak dia punya thyroid, kalau patient tu patient in supine position, you try to backward, tekan, then upward, you naikkan, elevate dia punya thyroid gland, thyroid cartilage, and then you go to right side a bit, right side of the patient, bukan right side of you, right side of patient, and then give a pressure. Sometimes you need to do bimanually. Bimanually maksudnya the operator, maksudnya yang orang yang nak intubate tu, dia pegang laryngoscope on the right and left hand, and then dia punya right hand tu you try to do the Burke maneuver until you nicely see dia punya vocal cord. Once you dah dapat tu, you minta the second rescue operator to hold for you. That's a bimanual. Bimanual punya maneuver is better than you do a tool punya operator. Meanings the intubation operator ada it's one person and then another person doing the Burke maneuver. Alright. And then position, this one is position for patient yang basically doesn't need for intubation, but you need to open up the airway. You can have a head tilt chin lift maneuver. You head tilt and you elevate dia punya mandible in order to open up the airway. And then for the trauma patient, you can have a jaw thrust. Basically, what the difference between chin lift and jaw thrust is you just elevate the jaw ataupun mandible without mobilize dia punya neck. So for the patient yang suspected having cervical injury, you need to do the jaw thrust because of patient possible ada high risk for cervical injury. For the head tilt chin lift, basically you try to you mobilize punya head, you head tilt and then chin lift, and then at the same time you mobilize your neck. And so for the trauma patient, you need to use a jaw thrust. And then we have airway adjuncts. We have the oropharyngeal airway and also nasopharyngeal airway. So when you open up the airway using head tilt chin lift ataupun jaw thrust, sometimes you doesn't maintain the airway. So if patient still having the stridor, even though you open up the airway, you need to use this. Basically, you need to maintain the airway when you open, and then you maintain the airway using the airway adjuncts. Basically, the use of airway adjuncts adalah to prevent the tongue from falling back tu je dia punya function. So you can use the oropharyngeal airway ataupun nasopharyngeal airway. How to measure the correct size? Basically, for the oropharyngeal airway, you need to use this mnemonic lah. Hard to hard, soft to soft. If you want to measure using hard to hard, you need to measure from the incisor, which is hard, teeth ni hard, and then to angle of mandible. Incisor to the angle of mandible, which is bone, hard to hard. Kalau you nak, if you want to use the soft to soft technique, which is angle of the mouth, which is soft to the tragus, of the ear. Maksudnya soft lah, tragus ni soft to soft, hard to hard, which is oropharyngeal airway punya size, the correct size. So you need to measure the correct size. So the contraindication for oropharyngeal airway adalah if patient semi-conscious ataupun gag reflex still present. If gag reflex present, you cannot use the oropharyngeal airway. And then patient ada facial injury ataupun oral injury. Patient ada epistaxis, bukan epistaxis, dia punya tongue dah hancur, and then suspected mandible fracture. So that one you cannot use oropharyngeal airway lah. If patient ada maxillofacial injury, and then ada gag reflex, dua condition that is contraindication to use the oropharyngeal airway. Sorry. For the oropharyngeal airway, the contraindication adalah gag reflex sahaja. Otherwise, kalau gag reflex absent, you can use oropharyngeal airway. Otherwise, for the nasopharyngeal airway, if suspected patient having maxillofacial punya injury, patient datang dengan epistaxis, very abnormal punya contour of face, and that one you tak boleh bagi nasopharyngeal, you tak boleh insert nasopharyngeal airway. If dia punya maxillofacial punya injury already excluded, and then gag reflex present, you can use nasopharyngeal airway untuk that patient because of gag reflex present. How to measure the correct size adalah you need to use the patient's punya little finger. You can have a patient punya little finger, you measure side to side. Kalau sama, lebih kurang sama, similar, the same size, you can use that nasopharyngeal airway. Ataupun you just measure patient punya nostril lah, berapa besar patient punya nostril. So dia punya length doesn't affect dia punya size. So dia tak perlu measure from incisor to the mandible ke apa, tak perlu. You just use the patient punya little finger sahaja, ataupun the actual size of nostril patient. Alright? Okay. Alright, this one is sizing. Crab placement. How you insert oropharyngeal airway? Basically, you have a two method. Either you can put the tip of the punya ni, tip of the nasopharyngeal airway touching the hard palate. I think yang ni saya kena tunjuk lah, nanti tak nampak, nanti after this lah. Alright, 10 minit lagi. Alright, so we go to the oxygen therapy. So why we need to give the oxygen to this patient before intubate? Because of this one lah, time to desaturation. For the normal 70 kilos adult, when patient doesn't breathe apnea, dia akan desat after 7 to 8 minutes. If patient ill adult, 5 to 10 minutes, 5 to 6 minutes. For the pediatric patient, normal 10 kilos child, after patient apnea, after 3 minutes already desat. For the obese patient, So about 2 to 3 minutes, if patient apnea, patient akan reset. So that's why we need to give the oxygen because of kita nak pre-oxygenate patient, because of kita nak denitrogenate. Maksudnya when we inhale the oxygen, about 71% is oxygen, and then 78% is nitrogen. So what happen? Patient dia akan ada masa time to reset will be cepat lah, because of the concentration of oxygen is minimal. If we give the pre-oxygenate this patient, dia akan denitrogenate. Maksudnya dia akan replace all the 78% of nitrogen into the oxygen. Possible you can get pre-oxygenate about 5 to 10 minutes, you can get the 100% oxygen inside your lung. So we have the oxygen reservoir inside your lung. And then if patient, when we give the paralytic agent, patient during that time patient is in apneic punya period ataupun time, and then dia akan ada masa untuk desaturation tu, dia akan ambil masa lama because of kita dah pre-oxygenate the patient having the high concentration of oxygen inside the lung. That's why we need to pre-oxygenate because of this one. And then this one is a Odyssey curve. Odyssey curve is dia punya ni SpO2 related to our partial pressure of oxygen in ABG. Sometimes when we get when we take the ABG, the partial pressure of oxygen about 60 is equal to 90% on SpO2. When the partial pressure of oxygen is 80, we can get almost 100% of oxygen. So you need to maintain, you can have a range, right? Range about 60 to 90 in order to maintain the oxygen about 90 to 100%. Okay. So based on this graph, you have a flat part and also flat part dan juga apa ni? Saya tak ingat ni. Sorry. Flat part. Contoh kalau you nak tengok, kalau SpO2 about 90% oxygen, this one is equal to 60 partial pressure of oxygen. Kalau dia less than 60, dia punya graph is dramatically dia akan drop. Very drop. Kalau less than 60 dia akan drop dengan cepat. Tapi in between dalam 90 to 100% dia punya decreasing punya oxygen is very minimal. It's not dramatic. So you need to make sure patient having oxygen SpO2 more than 90% to 100, and then partial pressure is 60 to 90, because of this one is a safe punya range. If less than that, they akan dramatically drop the oxygen. So the indication for the institute of oxygen therapy is because of hypoxemia. As you know from the Odyssey curve, if less than 60 ataupun 90, dia akan drop dramatically. Dia akan drop very dramatic. Alright. For the systemic hypotension, satu, because of BP less than systolic BP is less than 100. This one of the indication. Cardiac arrest ataupun respiratory arrest boleh, and then low cardiac output ataupun metabolic acidosis, bicarbonate is less than 18, so you can give oxygen for this patient. And then patient still SpO2 is maintained, but RR is more than 24 minutes, so there's an indication for oxygen supplemental therapy. Alright, this one, oxygen during CPR, you need to give the high concentration of oxygen during CPR. Okay, we have the oxygen delivery device, which is if patient still conscious, you can then still can protect the airway. You have a nasal cannula, face mask, ventral mask, and then high flow mask oxygen. And then this one I will talk later after Dr. Nazrul punya lecture. And then this one also sama. This one pun samalah after this lah. I think our time already 11:30, right? So after Dr. Nazrul punya class, we will continue our lecture, and then also practical session after Dr. Nazrul class. Okay? Boleh ke?
Boleh, Doktor.
Sebab dah 11:30. After this, we continue our lecture, and also we continue with Airway punya practical session lah, so-called practical session lah basically. Alright, I will show you the equipment device. The Airway punya device, and then some of practical punya skill lah. Alright, after this. So your lecture about 1 hour dengan Dr. Nazrul?
Yes, Doctor.
Okay. So kita jumpa 12.30 Boleh? 12.30 dalam 30 minutes je. And then we can end our session dalam pukul 1 macam tu lah. Okay? Okay, thank you semua. We postpone our lecture today dengan tasbih kafarah wa suratul as. Subhanallah wa bihamdika asyhadu an la ilaha illa anta astaghfiruka wa atubu ilaik. Alright.
Thank you, Doktor.
Thank you, Doctor.